Hey guys, welcome back to another episode of Tattoos and Telehealth. I'm Kelly White, I'm a board certified family nurse practitioner, and this is my good friend and colleague Nicole Baldwin, who is also a board certified nurse practitioner. And she is going to chat with you guys about her specialty, which is weight loss and overall wellness in that area and nutrition and kind of what that looks like. We have had a lot of patients actually that have had some pretty good questions when it comes to medications and how to treat their weight loss journey. And so, Nicole, can you touch base on what that's looking like right now for patients and what they do when they reach a peak essentially in their treatment?
So patients have reached out now that GLPs have been out for a while, and they are at, some of them, not all of them, but some of them are at the max dose, and they're kind of like a plateau. Where do we go from here? And that's a really good question. And I want to just back up. When you're prescribed these medications, for those of you who are just starting the medication or who are restarting the medication or have never taken these medications, when or if you get on GLP-1s, the goal is weight loss and appetite suppression. The goal is not to climb the dose. More is not better with this. Number one, for side effects. Number one, that's a big one. And number two, when you get to the top, there's nowhere to go. And so it is important that you stay at the lowest effective dose. And so even though we preach this to our patients, stay at the lowest effective dose, stay at the lowest effective dose, save your money, they still think more is better, and more is not better. If you need to go up, absolutely. But now we have patients that are at the top and they're like, I'm at a plateau. I don't know what to do. And so, there certainly is different things. Number one, you can increase your cardiovascular activity. That is super, super important. When you're on GLP-1 therapy and you increase your cardiovascular activity, your movement, that's like 1+1 is 3. I mean, it is super, super helpful.
And weight training too, right?
Yes, weight training, especially for women and men. As we age, women's bones just get fragile, and so even low weight training is super helpful to keep our skeleton strong, because keeping our muscles strong to support our skeleton as our bones naturally become fragile is super, super important. So increasing your protein intake, decreasing the amount of carbohydrates you're taking in is super helpful. The other thing is you can always go off of it for a little while and then start back up at whatever dose your provider deems appropriate, which will probably not be the 15 milligrams or 2.5 or whatever it is. So it's a good idea to give, if you're not diabetic, to give the body a break. You can go down a dose, right, for a little while and just see how you do. But patients can go off this cold turkey and just try to maintain the healthy lifestyle that you've learned. The decrease in amount of portions, your stomach has shrunk, your energy has likely increased. So stay active just like you are. Then if you need it, you can always go back to it. But once you climb that dose, there's not anywhere else to go. So it's important. You can switch in between GLP-1s as well. That might be a helpful option to you as well. Switching from one GLP to the other, because they do have a little bit of difference in them, although they're still in the same class. And so the first thing is increasing your activity. The other thing is possibly going down a dose. The other thing is possibly going off of it for a little while before restarting it. So, just be diligent with what you're eating. Be diligent with trying to stay on track, and you'll be back to losing weight in no time. Especially as we get to our goal weight, our body really wants to keep a hold on those pounds. Really. So most everybody who gets near their goal weight is going to reach a plateau. So even though you didn't lose any weight, or maybe a minimum weight, for a month or two, and you're still doing okay with your appetite, stay the course. Increase your hydration, increase your protein, increase your cardiovascular activity, and chances are that'll kick right back up.
I think it's important when you mentioned goal weight. I think it's important also to remind folks, because this was a hard one for me to digest sometimes, that sometimes my goal weight is not my body's goal weight. Your body knows what's healthy for you. Your body knows what's right for you. And you may want to see yourself a little thinner than your body realizes is healthy for you. And it may not want to get there. Like Nicole said, it wants to hold on to that because it knows, no, this is where I feel the best and I want to stay here. So sometimes setting a realistic goal is really important in these settings.
It is certainly, because even though the BMI was normal, if I was ever to get to, and I don't want to, but if I was ever to get to the weight that I was 20 years ago, which was the low end of normal, I would look sick, just because as we age and have children, our body shape changes. And so what you were 10, 25 years ago may not be what is going to be healthy for you now. So it really is a case by case basis. And it also is just how do you look and how do you feel? The number on the scale doesn't necessarily define you. It was hard for me to, I've kind of gained and lost just over the course of, I'm mid 40s, right? Nobody ever stays their perfect weight. But sometimes it's like, I want to try to squeeze into a smaller number on the shorts. But when I think about it, nobody sees that number but me, right? Yeah. Do I want to look like a pounds of potatoes in a 5 pound sack? So no. So, get the next size up or get whatever fits you. And that may be what's healthy for you. A size 10 looks healthy on me based on my height. I'm 5'11". I think you're 5'11" too, aren't you, Cal?
5'8".
Yeah. Oh, 5'8". I thought you were taller. Anyway, so based on my height and my age, a size 10 looks. I can't go down any lower. I would just look sick, even though that was a healthy weight for me back in the day. So yeah. So just
Setting healthy, realistic goals.
Yeah. But your body will try to hold on to the weight. Your body knows. But stay the course. Increase your activity, and you will definitely burn. You'll definitely burn some more. So
Definitely.
that is a wrap for today. This is Theo. This is Theo, and he's my supervisor for today. He's a rescue kitty.
Also, we always love our comfort critters.
Yeah, for sure. He's definitely comfortable. So, all right, guys, thanks for joining us today. And we hope you have a wonderful week. If you have any questions, please send us a message. You can email us. You can go to our website, HamiltonTelehealth.com. You can like and subscribe, comment, follow us, all the good things. Okay.
All right, guys, take care. We'll see you next time.
Bye.